Mr. Secretary, let me start off with you po. Were you surprised with the President's announcement last night on the ban on vaping?
Well, yes, I would say I was a bit surprised, but I was hoping that there was going to be an EO that's quickly forthcoming.
So you were not consulted, the department was not consulted because the President gave this order as a health issue, and we would have thought that he would have consulted the DOH first.
Well, I think indirectly, in the sense that when they found out about the 16-year-old teenager
Yes, sir.
who was hospitalized because of acute respiratory distress and confined in a private hospital in Central Visayas, where eventually she was put in the ICU and worked up. And thankfully, the teenager recovered. And so I guess that news, that bit of news, triggered the President's reaction.
Okay, Health Secretary Duque, could you settle something for us as well? I mean, a lot of people are watching, and a lot of people know, a lot of people who are already vaping, already into e-cigarettes. Some people are vouching na this is helping me quit smoking. Some people insist na may nabasa ako, hindi raw to harmful, it's less harmful. Where does the DOH currently stand, and where do the scientific studies currently stand? Is this harmful or not?
Well, if we are to base these on the findings in the U.S., there have been more than 20 states in the U.S. that have already reported EVALI, the e-cigarettes or vaping-associated lung injury. And in fact, 42 deaths have also been reported. So there you are. You have an increasing number of states and an increasing number of deaths as well. And the CDC, my latest reading, says that it is because of a particular product of vitamin E. I think it's a vitamin E acetate. That is an oily substance that tends to block the gas exchange between in the alveolar sacs of the lungs, no? So it's impeding the dynamic, the transfer of gas, O2 and carbon monoxide.
What about nicotine itself? Ano ba po talaga alam natin? Because people are saying, hindi, nicotine lang to, purong nicotine, addictive, yes, pero walang tar. What do we know about nicotine?
Nicotine is an addictive substance, and it has been shown for the longest time that it can compromise circulation and also affect the integrity of the cardiovascular system, which means it can have profound long-term effects. And so that has been pretty much established, no questions about it. So the vapors are always rationalizing that this is a much better way to quit. But I don't think it's really going to help them quit. You're just transferring from one vice to the next. And I think now that we have seen more acute cases of lung injury on account of e-cigarettes and vapes, then, this is a cause for concern. And as Secretary of Health, the DOH, the FDA, our position is really, if, we can ban it, we will ban it. But I understand the position of the other groups when they say that they want more evidence-based policy decision-making. So we're in touch, with our counterparts at the Center for Disease Control of the U.S. So we're just getting more information from them.